My initial approach to solving a case is to first look at precedent. Are there any examples that we can use as evidence for determining the potential success of any interventions? In the case of Texas Health Resources, Tylenol had a situation we can learn from occur in 1982. Several consumers were killed shortly after taking Tylenol due to cyanide poisoning. As a result, Johnson & Johnson established a multi-pronged plan to combat the crisis. The first part of the plan centered on crisis management. How do we minimize the damage now was the question they sought to address. Their answer was to put customer safety first by temporarily halting the production of Tylenol and by issuing a recall for all Tylenol capsules. The next piece of the plan was to ensure future safety and attempt to maintain a strong customer base. New packaging would ensure Tylenol could not be tampered with in the future, while free exchanges and discounts would work towards making Tylenol the cheapest option available. Finally, Johnson & Johnson gave presentations to the medical community on the changes Tylenol had made, and the safety of the new packaging in the hopes of gaining credibility with an important audience. The end result was success. Johnson & Johnson took an incredibly difficult case and solved it. By focusing on consumer safety first, making changes to ensure future safety, and then marketing their actions, they were able to establish themselves as a company that would prioritize their customers over immediate profit. For Texas Health Resources, I suggest a similar plan of action. Following Johnson & Johnson's model, the first element to address is to establish what happened from an operational standpoint and fix the problems that come up. I recommend a retrospective conference utilizing an independent mediator and a few key personnel from various hospital areas, administration, nurses, emergency room doctors, and others whom dealt with the Ebola case. The goal of the conference will be to answer these questions. What problems arose, why did they arise, and how might they be fixed? After establishing an exhaustive list of answers, the conference will create a task force to deal with each issue. After the Ebola problems have been solved, the task forces will then move on to other diseases. The next element to consider is technology. When Mr. Duncan came to Presbyterian Hospital Dallas, key questions such as recent countries he might have visited and place of residence were not effectively communicated between doctor and nurse. I recommend creating a mandatory computer survey system used by doctors and nurses that has a list of key questions that must be asked of patients. In addition, it will store the answers and eliminate missteps of poor communication in the future. Another key area Texas Health Resources will have to address is the relationship between the nurses and hospital administration. Nurses were asked to deal with a deadly disease in which they lacked sufficient training and lacked proper safety gear. This relationship must be improved immediately, and I recommend 3 ways to do so. The first is to offer the nurses bonuses with stipulations requiring them to remain an employee for a predetermined amount of time in order to receive the amount. The second is to ask for nurse feedback and make policy changes to accommodate them. And the last is to maintain an open line of communication with the nurses in the future. They should not feel as if they have to go to the media rather than talking to administration. These steps will ensure the hospital is able to minimize overturn of nurses and help patch up the relationship between nurses and administration. The last major element of the plan is a large public relations campaign. The public relations campaign will feature 3 main topics. The first topic will focus on the education of the public about Ebola. The next will demonstrate the changes Presbyterian Hospital Dallas has made to ensure another case is not mishandled. And the last will highlight past success and the strong hospital ratings they have received. I recommend utilizing Nurse Vincent in the campaign as an emotional anchor. Furthermore, I suggest boasting of the 100% recovery rate amongst the nurses. Likelihood of success can be seen from Johnson & Johnson's case, but also from one of Presbyterian Hospital Dallas's own employees. Dr. Marcus Downs has been able to retain some of his patients by spending time on the phone with them, suggesting there is no danger. Ultimately, my plan will create a list of operational problems by utilizing the employees who went through the crisis. It will employ task forces to solve the issues and improve employee relationships. Finally, my plan will boost profit numbers through the increase of customers. Success will be measured through patient numbers, hospital staff surveys, and an independent assessment of the resources Presbyterian Hospital Dallas has provided their employees.